Dr. Tess Mauricio is with us, America's favorite dermatologist. We're talking about puckering up the perfect kiss and the perfect lips. So all the women today are after the perfect shaped lips, are we not, doctor?
Well, yes, we are, but you know, a perfect lip for Angelina may not be the perfect lip for me or you.
Thank you.
Well, you know what, doctor, that's what I was going to ask you. Thin lips. I have very thin lips, so those thin lips are not kissable. Is that right or wrong?
Oh.
Well, they are, but you know, it's really about confidence. It's really about what you feel fits your face. I actually was born with a very, very thin upper lip, and I thought, well, I'd like to get it, you know, to fit more the bottom lip, so I added a little bit of a Restylane filler there, and it's great, but nobody would look at me and say, oh, my God, she had her lips done, and I think that really is what scares a lot of women who want to try to, you know, at least refill what's basically deflated over the years, or fix what they think, wow, I wish I would feel sexier if I just had a little plumper lip.
And doctor, if you do it correctly, you can avoid that look of, oops, she had her lips done, because if it's done correctly. We have Sandra before, a picture of Sandra before. Okay, we're looking at a thin upper lip and a rather nice bottom lip, really.
Exactly.
Okay, what are you recommending that she does?
Well, what we did for Sandra, and she's in her late 50s, and as we all get older, like I said, our lips do deflate, and then we also develop those lines that kind of come from the vermilion border, and then lipstick bleeds up in those lines. And so what we did for Sandra is we added a little bit of filler. There's two fillers that are great for this purpose, Restylane or Juvederm. The results are instant, and as long as your doctor has a good aesthetic eye, that they're not going to make you have duck lips or look like Marge Simpson, it looks beautiful.
But we're looking at her after right now, and it was a vast improvement. And doctor, if they put that Restylane in the filler in the pad of the lips and avoid the edges, it eliminates that curling effect, doesn't it?
Yes, and again, this is all technique dependent. So the key is, you know, I tell patients, if you see people out there looking like they have horrible, fake-looking lips, they're not my patients.
No.
So
doctor,
it really all depends on who you go to, but it can be done so that nobody really can tell that you had.
We're looking at Patty right now, and again, she has like a similar situation, but a little bit more of an upper lip to start with.
Exactly, and for her, it's more like, well, you know, I am using these lip plumpers to no end, and I really feel better, and I feel sexier when my lips are fuller. So we just put a tiny bit of filler in there, not a lot, and again, you can control how much volume you put in, where you put it in, what part of the lip. Is it the edges? Is it the actual bulk of the lip? And you can really create a gorgeous-looking, fuller lip.
Doctor, how long does it last?
Well, the fillers are now lasting 9 to 12 months. So you can, like, think about it, you know, every year, and if you don't feel like you need it yet, you can wait.
Sounds
even longer.
Excellent. And what are what are the more popular products for the lips?
Well, like I said, there's a whole variety of lip plumpers, which basically are mostly some type of irritant. And that's why when you put it on your lips, the topical lip plumpers, they kind of tingle, because they're causing a little bit of irritation. It's drawing water in the lip itself, sort of like a minor allergy.
Do they work?
They do work. Yes, some of them really do work. But again, the results are temporary, and, you know, some people don't like that tingly, irritated feeling. And so that's sort of a way where you can kind of test whether you would think you'd like fuller lips. And then if you think, yeah, I really like it, then you can find a really good doctor to make it so that it can last and you don't have to think about it.
Doctor, but the real question today is, does it make you a better kisser? In other words, plump lips, does that mean I'm a better kisser?
I can imagine it will, because you feel sexier, and then there's more, you know, more cushion there. So I think it can only make things better.
Of course, sensual, fuller lips have been the envy of, that's been the hallmark, and that has been the yardstick by which we judge the shape of lips forever, I think. Doctor, right now the common things, other than the lips across the board, what are the most across-the-board issues that people walk into your office with?
Well, I think wrinkle reduction, you know, especially those what we call frown lines, 11s between the brows that just make you look like you're worried.
Yes.
Those are, nobody likes those, and actually that's probably one of the most common complaints, and easy to fix with a combination of, you know, Botox or Dysport that really addresses the muscle. It really prevents you from being able to make that movement. And then if you have a permanent crease there or a couple of permanent crease, we can add a filler just like what we would do for the lips or the lines around the mouth. Fill them in, and instantly those lines are much better or even gone.
Doctor,
excellent.
Thank you.
Yes, Doctor, thank you very much.
All right,
happy Valentine's Day.
Happy Valentine's, everyone.
Thanks, honey.
Okay, bye-bye.
Bye-bye.
Good advice.
It is.